Hi everybody, Dr. Sia here from the Dr. Sia channel. I want to just start off this video by firstly thanking all of the supporters of this channel. And in this video, what we're going to be doing is, let's just talk about what's going to happen in 2020. So in 2020, I got so many ideas about topics that I can talk about. And I got all of those ideas from my students at the university, from people who I've spoken to, just listening to people about what they think about psychology, what things they don't know, what things they would love to know. And it's given me a lot of inspiration and a lot of motivation to make lots of videos into 2020. So I really look forward to it. And today, is one of those topics. I was sitting at a dinner table and people were talking about, how do you even know if you need to go to therapy? Like we all have problems. That's just a given. We all have problems because we're human beings. We're all imperfect. We didn't have perfect upbringing. We don't have a perfect society. And because of this, we all will have problems. And I don't care if it's me or if it's you or if it's someone who spent 40 years meditating up in a mountain somewhere. We all have problems. So a big question then becomes, well, how do I know if my problems validate going to therapy? And that's the question we're going to answer in today's video. So let's get started. All right, so how do you know if your problems validate going to therapy? Now, that's a big question, really. It seems like a really small question, but it's actually a big question. Now, for most people who are watching this video, one thing that is really true is, how do you know if you need to go to therapy? Only you would really know. No one can tell you that you need to instead of you. You're the only one who can decide if therapy is right for you and if it's something that you need. Here's a couple of things, more than a couple of things. Here's 3 or 4 things that you can be looking at to consider, do you need to go to therapy? So one of the things that you can look at is to say whatever thing is going on inside you, let's pretend, for example, that it's anxiety. Say that you have anxiety. Now, what you need to be considering to consider whether that validates you, this anxiety is worth going to therapy over, is to consider, does it interfere with any aspect of your life? So does it interfere with you being able to be productive and enjoying work? Does it interfere with the quality of your relationships? Does it, for example, stop you from having thriving relationships with people, with friends, with family members, or with your partner? Does it get in the way of the enjoyment of your relationships? Does that anxiety stop you in your social life somehow, outside of your more intimate relationships? Does it prevent you from being able to thrive in your community? Does it, for example, prevent you from being able to go to a store and do some shopping or for groceries? Does it prevent you from leaving your home to go on a walk? Does it prevent you from joining a party where a lot of loved ones are and people who want to see you, but something inside says that you'd be too anxious to see those people? So that's a really good way to see if the problem that you're having, in this case we're using anxiety, is worthwhile doing anything about. Does it prevent you from doing anything that you would otherwise want to be doing? Does it prevent you from, for example, studying, if that's what you want to do and you've always been ambitious about studying, but sometimes and somehow it's just too anxiety provoking, so you don't? Now that's one thing to be looking at. So does it stop you from doing anything in your work or academic or social or relationship life? Another thing to be looking at is, does it cause you pain? Do you suffer? Do you do your work? Do you have your relationships? Do you attend those parties, but you're just always feeling like it hurts too much? Like you're pushing, like you're forcing yourself, like it's not as enjoyable as it ought to be, and you want it to be more enjoyable. Well, that's one more way that you can find out that you probably need to go to therapy or whether you need to go to therapy. So This then leads us on to this other idea that I have, that you can look within yourself to go, okay, so now I know that it's interfering with my work or with my academic life or my relationship life or my social life, or it doesn't really interfere, but those things are just not as nice as you want them to be. Then we can look secondly at, do you want to go to therapy? This is a huge thing and a huge barrier to come into therapy. I can't tell you the number of patients I have who come to therapy, and then when I ask them why they're there, they're like, well, someone else just told me I ought to come, and and I'm like, well, do you want to be here? I don't really know. Okay, do you have any problems you want to work on? No, not many at all. And then that becomes a barrier to therapy. It's not a barrier that we can't overcome, and we can, but if you can start thinking about that now, do you want to go to therapy? Do you want to improve the quality of your life? Do you want to improve the quality in your relationships, in your social life, at work? That's a huge indicator that therapy is for you. Another thing to look at is, do you think that you can do something about it now? Is there some part of you that says, no, maybe wait another 10 years, maybe wait another 15 years, maybe wait another 20 years. And in that way, there's just some part of you that constantly wants to procrastinate the issue. Could procrastinate the suffering. Really, if you think about it, therapy is there meant to help you. But this part of you that tells you to procrastinate it and wait, really is just telling you to suffer longer. But if that's not the case, and there's some part of you that says, I don't want to suffer anymore, I want to get on top of this, I want to do something about this, I want to improve the quality of my life, and I want to do that now, well, that's a really strong indicator that therapy is for you. Finally, one thing to think about is that therapy tends to be with another person. So do you want to sit with another person, a person that you will come to learn to trust, that you will come to learn to work with, to overcome your problems and improve your health? Is that something that you want to do? Do you want to sit with another person and do that? And if you want to do that, work with another person, that's again an indicator that perhaps therapy is for you. So, what did we talk about? We said, consider first of all, if whatever's happening inside, whatever the psychological problem is, if you think that it's a psychological problem that is interfering with your work, social, relationship, or academic life, or if it's just making those things not too enjoyable to you, then you can think about if it's something that you actually want to do. And then you can think about if it's something that you want to do now, you want to get on top of it now. And finally, if it's something that you want to do with another person. And if you tick all these boxes, then you can guaranteed say to yourself, therapy is for you. Now, even if you don't tick all of these boxes and you just tick half of them, it's still worthwhile giving it a go. There's no shame in it, there is no harm in it, and there's nothing to say that you shouldn't. It's not going to harm you to go. So another question then, a follow-on question that I'm just going to add here as a bonus, if you will, is, well, then how do you get started? Say you're finding yourself feeling motivated right now to go and get some therapy. How do you get started? Well, how you can get started is, typically in most countries, you start with going to your general practitioner, sometimes called a GP, or your house doctor. This would be the person. Your GP, more often than not, their role is to guide you towards the right specialist. So they talk to you about the problem that you're having, and then they guide you to the right specialist. It's called a referral. They refer you to the person that you need to be working with. And it's as simple as going to your GP, declaring that you have some psychological problems and that you want to work on those problems and that you're looking for a psychologist and that you want to work with. And then it's easy from there. They'll guide you towards the right ways that you need to be going, towards the pathway, if you will, towards meeting a psychologist. And what is available to you, though, is different between country to country, but a GP is always a good place to start getting that information. As per usual, I hope that these videos are really useful to you. I really like the comments and I try to reply to as many as I can. I hope you subscribe. I definitely hope that you press that bell button so you get updates this year, because I'll be just throwing videos in like nothing else. I'm super motivated and inspired, and I know that a lot of my viewers are too. So I'll see you around for the next one, and yeah, that's it. That's all I got. Super excited. Really good to see you. All right, I'll see you for the next one. Bye bye.